Hello everyone, my name is Xiaodong Yue. I'm a professor at Captain Nama University. Welcome to my course on personality psychology, and today's topic is on personality tests or psychological testing. And here are the questions for today's lecture. First, what is the scientific basis of psychological testing? And second, what are the standardized and non-standardized tests? Thirdly, what is standardization and what are included in this process? And fourthly, what are objective tests and subjective tests? And fifthly, what are the common forms and differences among these different kinds of tests? And keep these questions in mind. Let's start today's lecture. First, let's look at what are the uses of psychological testing. Psychological tests or psychological testing and other assessment instruments are administered in a wide range of organizational and educational contexts. The main purpose of psychological testing is to evaluate people's behaviors, mental abilities, and specific personality characteristics to assist in making judgments and decisions about their intellectual, educational, occupational, social conditions or suitability for specific purposes. And more specifically, tests are used for following purposes: to assess intellectual and psychiatric conditions of people, and to screen applicants for jobs and education and training purposes, and to classify and place people in educational or employment contexts, and to counsel and guide individuals for educational, vocational, and personal counseling purposes, and to retain, promote, or dismiss individuals in various educational and occupational situations. I don't have to go on with the rest. We know psychological tests are very important, but we need to realize there is a difference between standardized tests and non-standardized tests. The standardized tests have consistent or fixed directions and procedures for administration and scoring of tests. Various types of converted scores or norms may be computed from the raw test scores of the test of standardized groups for subsequent statistical analysis. While non-standardized tests have no consistent or fixed directions or procedures for administration and scoring of tests. No norms could be effectively obtained for computation of raw test scores for subsequent and unified analysis, statistical or otherwise. I know this may sound hard for you, but we need to know the key words: standardized and non-standardized tests. In addition to this, we also need to know the objective and projective tests. Psychological tests can also be classified as either objective tests or subjective tests, depending on the structure and the clarity of the tasks required of the examinees. Objective tests are seen as containing highly structured, clear, unambiguous test items that can be objectively and statistically scored and analyzed. Whereas for projective tests, they are seen as containing highly unstructured, unclear, and ambiguous test items, and they are hard to be objectively and statistically scored and analyzed. The objective tests are usually standardized, while the projective tests are not capable of being standardized, however hard the people have been tried before. Let's look at the typical objective tests and projective tests, what they are. For objective tests, the aptitude tests like IQ test, the typical objective test, and also aptitude test, and the personality tests, whether it's Big Five, or self-esteem, or self-efficacy, or anxiety. Okay, that's the personality tests, and also the interesting tests like vocational interests. Okay, what kind of jobs be good for you, for your career or vocational decision making, and also there are the affective tests, different kinds of mood tests. That would be the objective test using standardized test items to do the test. For projective test, there was the Rorschach, there was the TAT, there was the RISB, and there was the draw picture and stunt tray therapy or stunt tray test. Now what they are, let's look at them later. Let's look at the common standardized personality tests. Let's look at the Minnesota Multiphasic Personality Inventory, or more commonly known as MMPI. And there are translated versions in Chinese, Japanese, Korean, Thai, Vietnamese, and Hindi languages. And also the State Trait Anxiety Inventory, more known as the STAI, and there are translated versions in Chinese, Japanese, Korean, Hindi, Bengali, Kannada, and Tamil languages. And there's also the NEOPIR. What does it mean? It means neuroticism, extroversion, openness, personality inventory revised. Okay, so it is based on the Big Five factor model, and there are translated versions in Chinese, Japanese, Korean, Filipino languages. Okay, so this is like, just to give you an example. I want to talk a bit more about the MMPI. It's a typical example of what a standardized objective test is like, and you need to know. The original MMPI was developed in the 1930s using an empirical approach, which means that the clinical scales were derived by selecting items that were endorsed by patients known to have been diagnosed with certain pathologies. And then there are different updated versions. The MMPI-2 contains 567 test items and takes approximately 60 to 90 minutes to complete. It should be administered, scored, and interpreted by someone who has received specific training in the MMPI use. And the MMPI should also be used in collaboration with other test tools. Diagnosis should never be made solely on the result of an MMPI test. And here are the 12 subscales of MMPI-2. You can see the abbreviations and the description. For instance, there was the ego strength scale. There was the ego strength scale. There was the anxiety scale. There's a repression scale. The type A scale. Blah blah blah. I don't have to go on with the list. You can just have a look. And what is good about MMPI is that it could be presented, or the results could be presented on a report card, or it could be graphed of the results. So you see how cute it is, and you can see what your personality features, all your pathology characteristics are shown on this report card. Just like you test for your blood pressure and your sugar, blood sugar or whatever, and that could be reported in such a way. And this is the updated version, and you can see now there are more updated terms for the subscales. For instance, the anxiety, fears, obsessiveness, depression, health concerns, bizarre, lamentation, anger, cynicism, antisocial practices, type A, low self-esteem, social discomfort, family problems, work interferences, treatment indications, or whatever. Now, MMPI is also used interchangeably with Symptom Checklist 90, more known as SCL-90. They also have similar structure, and this is a typical standardized objective test. Now, what about a projective test? Let's look at this. What do you see in here? This is called a Rorschach picture. Okay? Whatever you see reflects your anxiety, your hidden fantasies or dreams. And this could provoke you to think of something that normally you would not show up. So this is called a projective. And here's another one. What do you think this girl is thinking? Do you think she looks happy? What is she expecting now? Can you tell a story? And that's what is called a TAT. And what about this? This is a painting or a drawing of a house. Originally, the person was only instructed to draw a house, a tree, a person. And this is what she eventually drew. And what do you think from this drawing you will know about her personality? And what about this? You see this sun tree, and you can see the two houses. What do they mean? Okay, so all of them are projective tests. And how they function? We'll examine them respectively.